Hi everyone, it's Kristen. I am going to be doing our regional assessment 4 of our abdomen. So I will introduce myself to the patient. I'm Kristen. I will be the advanced practice nursing student performing your exam today. And I get your name and birthday.
Todd Smith, August 25th, 1992.
Perfect, Todd. Thanks for coming in. Today I will be doing an abdominal exam. So it might consist of some light palpation, light touch. If at any point anything's uncomfortable or tender, please let me know, okay?
Okay.
So with any sequence, I usually start with inspection. So I will just inspect the hands, arms, shoulders for symmetry, muscle bulk, and any visible deformities. So I see no skin abnormalities, no visible lesions. Everything is within normal limits for his upper extremities there. I see no swelling, no skin changes, and no asymmetry of his joints upon inspection. We would move on then to our range of motion and then our muscle strength of our upper extremities. So I'm going to have you start by lifting your arms up like this. Perfect. And then can I have you lift them to the side? And then can I have you lift them kind of behind you? It might be a little bit of an awkward movement. Perfect. And then you can relax them by your side. Can I have you shrug your shoulders up and down? Can you roll forward and back? Anything bothering you there?
Nope.
Perfect. So normal smooth movements in the upper extremities. I'm going to have you, can I have you just basically mimic this movement for me? Anything bother you there? Can I have you move your wrists up and down? Yeah. And then rotate. And then your fingers, can I have you move? Anything bothering you there? Okay. So normal range of motion in his elbows, wrists, fingers, shoulders. So now we would move on to muscle strength. So I'm going to have you push against my hands with each movement, okay?
Okay.
And if anything once again is painful or bothering you, just let me know. So I'm going to have you shrug your shoulders up against my hands. Perfect. And then I have you hold your hands out for me. I'm going to have you push up. Perfect. And then push down. Perfect. And then I'm going to have you relax your arms by your side. And then you can grab my fingers and give them a good squeeze. Perfect. Anything bothering you there? Perfect. Okay. So our grip strength is 5 out of 5. Our strength, muscle strength, and range of motion are all intact upon assessment. So now we'll move on to our breast assessment. Again, with our sequence, we always start with inspection. So getting a good look at his breast for symmetry, any dimpling while you're seated. So dimpling, skin changes, you can kind of tell upon initial assessment, no visible masses, no lesions, no areas of concern upon initial inspection. I'll have you just raise your arms above your head just to check in the auxiliary areas. Don't see any abnormalities there, no lesions, no masses. And then I'll have you kind of put your hands on your hips for me. Again, symmetrical on both sides. No visible lesions, no masses, no lumps noted upon initial inspection. So I will have you now go ahead and lay down if you're comfortable. So we'll have you kind of, whatever makes, perfect. And this is where we can start with light palpation, and sometimes that's a circular motion around each breast, as well as just moving our fingers if you're not able to see quickly. I'm going to be assessing for any palpable lumps, masses, tenderness. I'll also have him lift his arms to check the axilla in that area. I'll be palpating kind of the tail of Spence, areola, the nipple for any discharge or any pain or tenderness there. Again, inversion of both would be another thing I would be looking for. So we'll kind of start with that. So just, again, light touch. You let me know if anything's bothering you. Perfect. Perfect, okay. And then do our other side. Okay. And then can I have you lift your arm above your shoulder? You can do both arms, actually, if that's comfortable. So again, I mentioned palpating the axilla, or this region under his arm, but I'm not palpating any enlarged lymph nodes or lymphadenopathy, no masses, no tenderness, nothing's hurting you?
No.
Okay, perfect. So the palpation of our breast area is all within normal limits, so no concerns there. And so we can move on to kind of our neck vessels, which is our jugular venous pulse. So I'm gonna, upon initial inspection, we would want him to be at a 30 to 45 degree angle seated. Of course, that's much easier to control when we're in a hospital setting or clinic setting. This is a little bit different of a setting, but we would want him to be at that angle to best assess for jugular venous distension. So we're mimicking it, 30 to 45 degrees, and I'll be our like semi-Fowler's position. So I'm gonna have you turn your head this way, inspect on that side. I don't see any jugular venous distension on that side. I'm gonna look this way. Again, nothing visible. I'm gonna have you sit up for me. And then I'm going to have you sit back down. Perfect. And his neck veins collapse appropriately bilaterally when he is sitting upright. So that's why I had him sit upright. So no concerns there. No distension and no jugular venous distension or JVD. We'll now move on to our cardiac. And I'm stepping forward because I think my light's a little bit off. But our cardiac examination. So our heart examination, I'll start again with inspection of the precordium, and then I'm inspecting the precordium for any visible pulsations, lifts, or heaves, which I do not see. And then to note, we can also inspect, palpate, and auscultate our apex, our apical pulse, which I'll be referring to throughout this portion of the exam. It's located at our 5th intercostal space, mid-clavicular line, so right about here on this patient, on Todd. And then I will just quickly palpate our precordium, and everything is within normal limits there. I don't feel any thrills, and once again, I'm not inspecting any abnormalities, no heaves, no lifts, no concerns there, no visible pulsations. Now we will move on to auscultation. So I will be listening with both my diaphragm and my bell and our 5 areas, which are aortic, pulmonic, herbs, tricuspid, and our mitral areas. Yes, mitral areas. With both the diaphragm and the bell. For time's sake, I would be listening to my patient much longer than I am now. But I will move through those 5 areas with the diaphragm and the bell. So we'll start with the diaphragm. And then the bell. Again, in a real clinical scenario, I would have been auscultating in each area a lot longer than I was. But upon initial auscultation, I would say his rate's about 60 beats per minute. Heard no abnormal heart sounds, just S1, S2, no S3 or S4, no murmurs, no gallops. I will have you, though, if you're able, to lay on your left side for me. I will auscultate that apex, that apical pulse, like I mentioned, right on that 5th intercostal space, mid-clavicular line. I'll auscultate for any additional sounds or abnormalities. Sometimes that can show us some, or can help me auscultate some sounds that weren't present on that initial cardiac exam. Is that a comfortable position for you? Okay. Let's make sure we're on that bell side. Perfect. And then I can have you turn right back to where you're comfortable. So no additional sounds or abnormalities auscultated there. So now what we can do is move on to kind of we've been doing our abdomen, but down to our stomach area, our abdomen area. So again, we always start with inspection. So upon initial inspection, abdomen is flat, symmetric, skin is smooth, appropriate for ethnicity, no lesions, again, no visible masses or protrusions noted, no bloating. So upon initial assessment, which can also tell us a lot, or initial inspection, I see no abnormalities. The umbilicus is also just a good thing to check, is midline. And so no abnormalities inspected there, no hernias, no discoloration noted, and again, no visible masses. We can now move on to auscultation. So this will be within those 4 quadrants. Again, just lightly, gently moving through your abdomen, and again, if anything is bothering you at any point, let me know. So I'll listen typically with my diaphragm in those quadrants, those 4 quadrants. Again, for time's sake, I would have been listening much longer in each quadrant, but so his vowel sounds are normal active, so normal there. I don't hear any abnormalities, just normal active vowel sounds in all quadrants. I'll also auscultate over the aorta, renal, and iliac arteries with the bell of my stethoscope. So I'm not auscultating, not hearing any bruits in those areas. And so now we can move onto percussion. So light percussion on the abdomen. Again, just gentle taps around your stomach area. So you let me know if anything is bothering you at any point. Start here. I just wanted to percuss the liver. Now the spleen. Again, I'm hearing tympany over the majority of his abdomen. I do note some dullness, which is a normal finding over his liver and his spleen upon percussion, but no abnormal sounds or issues with percussion. So now we'll start with palpation. Start with light palpation, which will be gentle circular motions throughout your abdomen. Again, tell me if anything is bothering you at all. And then we'll move on to more deep palpation, and also can kind of assess the location of those organs, and for any enlargement of abnormal enlargement of our organs. And so we will start with light. And again, it's always important to make sure that we're auscultating prior to palpating. Anything bothering me there? Okay. So no tenderness noted upon a light palpation. No masses noted for me upon light palpation. So we'll move on to our deep palpation. Anything bothering you? Okay. So this does confirm the deep palpation or palpitation. Confirms soft, non-tender abdomen with palpable or with no palpable masses. And the aortic pulsation, which will be here, is normal. The width is about 2 to 3 centimeters and regular. And then our inguinal area, our femoral pulses bilaterally, we would assess about right here. That's okay. Let me know if anything's bothering you. So our femoral pulses are strong and equal bilaterally. And then no lymphadenopathy or masses that were palpated in the inguinal area. So that does conclude our abdominal assessment exam this week. Do you have any questions or concerns for me?
No.
Okay. Well, thank you for coming in. Thank you.